Assalamu alaikum everyone. Today we're gonna talk about the next cranial nerves. They are third, fourth, and sixth cranial nerves. I hope and I believe that today you will get beneficial information for your future career. First of all, look at that. In these illustrations, we provide information about the normal function of the muscles and cranial nerves. First of all, look at that. And in the black color, I draw the oculomotor nerve, the third cranial nerve, and it can innervate the 5 ocular muscles. First one is levator palpebral muscle. Second one is superior rectus muscle. Third one is medial rectus muscle. Fourth one is inferior obliquus muscle, and the last one is inferior rectus muscle. And the next cranial nerve is fourth cranial nerve. That's name is trochlearis nerve. Trochlearis nerve innervates only one superior obliquus muscle. Okay, and the next our muscle is lateral rectus muscle is innervated by the sixth cranial nerve. That's name is nervus abducens. Okay, and the third and fourth cranial nerves located in the crus cerebri, and the sixth cranial nerve located in the pons. Okay, and what is the main function of these muscles? Okay, we will talk about that. The main function of the levator palpebral muscle is in elevating the palpebra. Okay, without its normal function, we couldn't open our eye. Okay, and the next muscle is superior obliquus muscle. Superior obliquus muscle, its main function is deviating the eye inferiorly and medially. Okay, that's the main function of the superior obliquus muscle. And the next muscle is superior rectus muscle. Superior rectus muscle deviates superiorly and laterally. Okay, and the next muscle is medial rectus muscle. Medial rectus muscle deviate the eyes to the medially, okay, to the nasal side. And the next our muscle is inferior obliquus muscle. Inferior obliquus muscle deviate inferior obliquus muscle deviate the eye to the superiorly and medially. Okay, that's part of this is the main function of the inferior obliquus muscle. Our last muscle is not last, inferior rectus muscle. Inferior rectus muscle deviate the eyeball to the inferiorly and laterally. Okay, and our last muscle is lateral rectus muscle. Lateral rectus muscle is innervated by nervus abducens and deviate the eyeball to the lateral sides, to the temporal sides. Okay, that's the normal function of the eye muscles and their directions of the eyeball. Okay, and look at that. We have 6 different eye gazes. Okay, first one, look at that. When the first gaze is upward and to the right gaze. Okay, in this position, superior rectus and inferior obliquus muscles get its action in the right and left eye respectively. Okay, and our second type of the gaze, the eyeballs to the upward and to the left gaze. Okay, in this position, inferior obliquus muscle and the superior rectus muscle get its action in the right, in the left eye respectively. Okay, our third gaze is rightward gaze. In the rightward gaze, lateral rectus muscle and medial rectus muscle get its action in the right and left eye respectively. Our first leftward gaze, you can find out there the action of the lateral rectus muscle and medial rectus muscles in the left and the right eyes respectively. Okay. Our last two gazes drawn there. Look at that. When you look downward and to the right, your inferior rectus muscle and superior obliquus muscle in the right, in the left eye get its action respectively. Our last gaze is downward and the left gaze. In this position, superior obliquus muscle in the right eye and inferior rectus muscle in the left eye show its action. Okay, and in the green color, I draw the number of the cranial nerves. Okay, by this illustration, you can easily understand the eye movements. Okay, and all of the information about the normal function of the eye deviation and eye muscles. Okay, and the further information for you, all of the eye muscles connected to the tendinous ring. Okay, tendinous ring's main function is sustaining all of the muscles, all of the eye muscles. Okay, and I have further question for you from the endocrinology part of the medicine. You know, in the Graves' disease, exophthalmia may occur. Okay, in the exophthalmia, in the Graves' disease, you know, autoantibodies may appear in the human organism, and they can show its negative effect on the orbita. Okay, in the retroorbital space, there are fibroblasts and adipocytes in the retroorbital space, and some kind of antigens, autoantigens, can get there and stimulate fibroblasts and adipocytes and can enhance their multiplying and their size. By multiplying and being enlarged, they try to show its negative effect by causing exophthalmia in the eyes. Okay, it's further information for you. And the next, our information is related to pathology of the cranial nerves, third, first, and sixth. Okay, first one, please, let's talk about the third nerve palsy, oculomotor nerve palsy. Before I provide information about that, I should talk about that. The third cranial nerve contain autonomic nerve system, more specifically parasympathetic nerve system, and that's the nucleus located there and combined with the oculomotor nerve and discharge it from this side of the nerves and enter the eyeball, and it can reach to the iris and ciliary muscles, and its main function is for accommodation and light reflex. Okay, for constricting and dilating the iris and pupilla, constricting and dilating of the pupilla, and contraction and relaxation of the ciliary muscles. By this way, it can maintain the accommodation and the light reflex. Okay, and don't forget this function. Okay, and in the oculomotor nerve palsy, when the patient come to your room, as a neuropathologist, you can watch the patient and ask some complaints. The patient say that I couldn't open my left eye. I couldn't open my right eye. Okay, and the main reason for blinking of this eye is the inappropriate function of the levator pulpary muscle. You know, the levator pulpary muscle is innervated by oculomotor nerve, and when you open the eyelid with your hands, you can watch the dilation of the pupilla. Okay, the main the reason for dilation of the pupilla, there is no parasympathetic innervation by oculomotor nerve. You know, the parasympathetic nerve system can constrict the size of the pupil. Okay, without this function, it can dilate. Okay, and there is some kind of deviation to the left and to the right and the down side. Okay, one of the main reasons for that is in this part is located the lateral rectus muscle, and the lateral rectus muscle is innervated by nervus abducens. Although the accumulated nerves couldn't show its effect, couldn't show its normal function, in this period, the lateral rectus muscle can function normally by innervation from the nervus abducens. Its main function is nervus lateral rectus muscle deviate to the right side, okay, to the temporal side. You can find out this kind of picture in this patient. And the next palsy is first nerve palsy, is an abnormal function of the trochlear nerve. And when you say the patient look directly, the normal eye can locate in the middle, but in the affected eye to deviate to the nasal and superior part. Okay, one of the main reasons for that is the main function of the trochlear nerve is innervating the superior obliquus muscle. Superior obliquus muscle's main function is deviating to the down part. Okay, without this normal function, inferior obliquus muscle can show its effect and deviate superiorly the eyeball. Okay, and the next information is sixth nerve palsy, abducens nerve palsy. The nervus abducens innervate lateral rectus muscle. Lateral rectus muscle's main function is deviating the eyeball to the lateral temporal part. Okay, and without normal function of the nervus abducens, the medial rectus muscle can constrict more strongly and can deviate to the nasal part of the eyeball. Okay, and further information for you is in these three kind of nerve palsies, patient can complain that I have a double vision. We can call this in the medicine diplopia. Okay, and one of the main reason is in the normal function of the eyeballs, both of the eyeballs should concentrate on the one thing when you watch something. For example, my marker. Okay, and without this function, for example, in the nerve palsy in the fourth cranial nerve, this deviation can show its negative effect. Both eyes couldn't focus on one thing. Okay, by this way, the patient can suffer from the diplopia, double vision. Okay, and when the nerve palsy of the fourth cranial nerve, when you ask the patient to, in this position, to the left and superior part, diplopia may not occur in this patient because this affected eye doesn't move the eyeball, and the eye in the normal eyeball can move to there, and the same picture can eliminate the double vision. And when you ask the patient to look at the right side, this eyeball to deviate to this part. Okay, but the affected eye couldn't move. It can enhance the diplopia. Okay, in this position, patient says that the diplopia is enhanced, and by this way you can diagnose correctly to the nerve palsies. Okay, all of the information today we were going to get for you is all. Thanks for listening and watching. And if you have any complaints or some kind of suggestions and offers for our video lessons, we are always ready to read from the comment part of our YouTube channel. Thanks for listening. Take care of yourself.